Another place where the multi-channel service was incredibly important was last summer when we were faced with pandemic flu. So about this time last year, our core service was being deluged by people who were either wanting information about the pandemic or felt themselves to be unwell, rather as I do now. And what we discovered in that was that our ability to deploy multiple channels, particularly the web, was absolutely vital in protecting the core service and protecting the time of nurses and protecting primary care to enable them to look after people who were really ill. And this is what it looked like for our core telephone service. And in July, we deployed the National Pandemic Flu Service, which enabled people to do either by telephone or themselves an online algorithmic self-checker, leading ultimately to the authorization of antiviral medication. 2 million people used that service, and about 40% of them did it themselves online, which I think is truly remarkable. And had that not been available, it's difficult to imagine how primary care would have coped during that period. I'm going to talk briefly about the opportunities of technology in elective acute care. The example I've chosen is decision aids, patient decision aids. I don't know how many of you will have come across these. I think there's now a very good research base to say that for certain conditions and interventions where there's more than one medically possible alternative and where particularly the risks and benefits are quite finely balanced and depend upon the individual's personal priorities and preferences, a decision aid can be very, very helpful to people to enable them to make real choice. And I'm not talking about choice of when and where they have their operation, but choice of what kind of treatment is really best for them. And the evidence suggests that in some conditions where those conditions apply, people having gone through a structured decision aid process are choosing not to have complex, risky, expensive interventions. And here are some data showing some of those examples. NHS Direct is working with our commissioner, the East of England Strategic Health Authority, which commissions us on behalf of the whole of the NHS, to develop 6 decision aids, which are a combination of being developed from new and anglicising decision aids that are used in other markets. And we're piloting those with primary care trusts around the country to show how a decision aid and to work out how a decision aid can be dropped into a patient pathway to help patients make a good decision about what treatment is right for them and to manage demand in a truly ethical way. Moving on to long-term conditions, I mean, you really don't need me to tell you how important long-term conditions are for the future of the NHS and for the future health of the nation. It's an area where deploying telephone and web-based support can make a real difference to people's lives. In NHS Direct, we're involved in partnerships with other providers of technology and analysis, and we're working particularly in Birmingham and in Nottingham to support about 3,000 people with long-term conditions. We're giving them telephone-based health coaching and advice, which is helping them improve their quality of life and keeping them out of hospital. We've looked a lot earlier this morning about patient records and how technology can improve public health in that respect. There are particular segments of the population where a multi-channel approach is exactly the right one to hit high-priority public health targets. In NHS Direct, for example, we've done some pilot work in emergency contraception to make that kind of advice available very easily, simply, and confidentially to young people in ways that make sense to them. So this is a screenshot from Bebo, which is a site used primarily by teenage girls. You can see on the front page of Bebo we had an access route into NHS Direct for confidential advice for people who were worried that they might be pregnant. That led into our emergency contraception screen, which led into the ability to have an entirely confidential, anonymous, personal web chat with an NHS Direct nurse. Another way in which we've supported public health targets is in the national HPV screening and vaccination campaign. In Habbo, This is a shot from the NHS's own information source, which was accessed through Choices. And there are a range of options for young people, including this one, which was a virtual room in the Habbo Hotel. So I don't know how many of you will have visited Habbo Hotel. It's certainly not somewhere where I spend a lot of time, to be honest. But you can see, where's my pointer? This is Habbo Hotel. Here's the virtual room in Habbo Hotel, where these avatars are young people, girls, who are visiting the NHS Direct nurse in the Habbo Hotel and asking questions about the HPV campaign and what it's like to have your injection against cervical cancer. So those are some examples where we in NHS Direct are using technology to help the NHS meet its own targets and meet its own challenges. And we don't consider ourselves to be a monopoly provider in this sphere at all. So as well as providing these services and continuing to evolve and pilot ideas in partnership with the NHS, we're also here to help NHS organisations think about how they themselves want to use technology to meet their own goals and priorities. I'm going to talk a little bit about patient safety and the impact of this sort of channel on health professionals. So I'm going to change hats very quickly, and I'm also, as well as being chair of NHS Direct, I'm chairman of a company that, a not-for-profit company that publishes medicines information on the web. It started as a company that was brought together, that was established to produce a book. And this was the compendium of data sheets. So that had all the regulated information, the summaries of product characteristics and patient information leaflets for prescribed medicines. And the point about the book, as that picture amply demonstrates, is that as soon as it was published, it was out of date. There are 20,000 license changes to medicines licensed in the UK every year. And even between the companies submitting that information to us to put in the book and the physical publication of the book, those were all the changes that had taken place. So now, of course, we provide this online through the Electronic Medicines Compendium, which is the primary source of regulated medicines information used by health professionals and particularly by clinical pharmacists around the country. And this is updated in a matter of days from license changes, so it's a continuous, comprehensive and accurate resource contributing to patient safety. So, that was a very brief counter through, and I hope that we'll have some time a bit later on to discuss what some of these things might look like and some of the challenges that we face in bringing some of this stuff more to life and making it more widely available. I think, in conclusion, what we are working towards is really best described as a virtual self-service NHS. And that's what together we need to do. We need to transform the NHS from the purely physical to the multi-channel, from physical to digital, making it possible for people to access the health service through channels and in ways and at times that really suit them, to protect and safeguard the NHS's precious high-value face-to-face and bricks and mortar services for the people who really want and need them. Our NHS needs to go from closed to open. We need an assumption that all information is available to patients so that they can take real ownership of their own health, supported by professionals who can help them interpret and act on that information so that they can make better decisions about their health and their care. We need to move the NHS from an expectation that patients are passive recipients of care towards being active consumers. We need to harness people's desire to do more for themselves, to empower them, to enable them to reduce cost, have a better experience, and using consumer power to drive up standards in the health service. And finally, we need a service that is transformed from one that's designed around the NHS to one that's designed around the individual, so that we need to have digital entry points to the NHS in the virtual spaces where people already spend their time, making it possible for people to access a whole range of both NHS and privately provided independent sources of advice and support and information to improve their health. So I hope that that gives you some sense of what's possible today, now, And I hope that that's something that we will work together to create in the future. Thank you very much.